Hi all, welcome to my presentation on the Australian healthcare system. Just gonna click to this next slide because it's a bit of a disclaimer. So I've tried to be as accurate as possible with all of my information that I'm giving you. But this is just intended to be a very basic guide to the fundamentals of the Australian healthcare system. So before you put any of this information into practice, I would recommend just researching it for yourself beforehand, because again, I've tried to make it as accurate as possible, but I can't promise that everything is going to be 100%. All right. So, what is the Australian healthcare system? So, the World Health Organization defines a healthcare system as being all the activities whose primary purpose is to promote, restore, and or maintain health. So that pretty much means that it's not just there for when you get sick, it's there always so we can maintain your health and prevent you from really getting sick. So the Australian healthcare system is a complex mix of Commonwealth and state government funded services, and services funded by private health insurance. So our Australian healthcare system, when compared with the healthcare systems in other developed countries, we actually have we have above average health outcomes, and we also rank really well for life expectancy. So we're obviously doing something right. At the core of Australian healthcare lies the National Health Act, which was passed in 1953. So it's an act of parliament which aims to regulate the provision of pharmaceutical, sickness, and hospital benefits, and for medical and dental services. So this act covers nursing homes, the pharmaceutical benefits scheme, and registration of all private health funds. So what is Medicare? So Medicare is Australia's universal health insurance scheme and was introduced in 1984. So it aims to provide subsidised healthcare and financial assistance to eligible persons. It's funded partially by by an income tax surcharge called the Medicare levy, which for most people is generally about 1.5% on taxable income. So for those who don't have private health insurance or are on a higher income, it will be about 2.5%, but 1.5% is pretty much standard for Australians. So Medicare targets Australians, and there can be sort of a lot of debate as to what constitutes an Australian. So, what constitutes an Australian in the eyes of Medicare, I should say. So, Medicare covers permanent citizens of New Zealand and Australia, permanent residents of Australia, and people of a few other countries with a reciprocal agreement. So, a reciprocal agreement is something that Australia has with other countries, so that Australians visiting those countries and people from those countries who are visiting Australia will be able to have some costs covered for medically necessary care. So Medicare isn't available to everyone living in Australia. You have to meet certain requirements to be able to be eligible for Medicare. So those who are eligible for Medicare can apply to benefit from it, and they will be given a Medicare card, which looks kind of like this, and it's got a unique 10-digit number. If a citizen is part of a family, the whole family can actually be listed on the same Medicare card, but they will have the same Medicare card number. So to differentiate between them, we use what we call the reference number, which is the number next to a person's name. So that sort of corresponds with where they are in order on that card. So as we can see here, that first person will be reference number 1. So they'll be the first person on the card. So the Medicare card, although Medicare itself renews every time it expires, it renews itself automatically. but the card itself expires every 4 years. So the expiry date is displayed on the card in the bottom right-hand corner, which is here. So that's pretty much just, it won't really change all that much about it. You'll still be valid for Medicare if your card is expired. It pretty much just is an indication that you need to get a new card, need to update your details on that card. So Medicare is able to provide a subsidy, or what we call a Medicare rebate, for a broad range of services, all of which are included on a list of services termed the Medicare Benefits Schedule, which is shortened to MBS. So essentially the MBS is a list of every medical service for which Medicare is able to provide a rebate. Each service is assigned an item number, which is essentially a unique identification code for each service of a specific type. Also associated with each service is a standard fee for which Medicare will pay. So this fee, this standard fee, is termed the scheduled fee. And that's sort of the amount that Medicare agrees to pay towards specific services. So you can actually view a copy of the MBS schedule online just by searching MBS online, and it should come up with it on Google. So with the MBS, there are a bunch of different service categories. So services are categorized and differentiated by the amount of time the service takes, the qualifications of the healthcare provider who provided the service, and the actions which were taken within that service, and so on and so forth. There are many different categories of health practitioner within the Medicare schedule, but to be eligible for a health practitioner, for a health practitioner to be eligible to bill for Medicare services, they must have a provider number, which is essentially a unique identification number assigned to each practitioner for each location where they practice. So say if one doctor practices out of 2 locations, they'll have a provider number for each location. So it won't just be the same provider number for one doctor, they'll have one associated with each location as well. So there are 2 main types of provider. So this is just a bit of a slide on some more categories about the health provider. So they've got different numbers associated with them for each different category. Categories, I guess. So they need that provider number, which is the identification number. So as mentioned, there's lots and lots of different categories, but the 2 big ones for doctors and health providers are your general practitioners and your specialists. So a general practitioner is defined by Medicare as a general practitioner or non-specialist medical practitioner other than a medical practitioner or another medical practitioner who provides non-referred services but isn't a GP. So patients don't actually need a referral to see a GP. They can pretty much just book an appointment and go see them whenever they're not feeling too good. And they don't actually need to have a referral to be eligible for a rebate for these services. So they can pretty much, as long as they're a Medicare eligible resident, they should be able to just walk in or book an appointment and walk in and have this appointment with their GP. And Medicare will be able to pay for that, again, provided that they are a eligible candidate for Medicare. So the other kind is a specialist. So specialists are defined by Medicare as a registered health professional who is eligible or has an existing provider number and who has an Australasian Specialist College Fellowship or a registration with the Australian Health Practitioner Regulation Agency as a specialist. So specialists, you do actually need a referral from a GP or another specialist before you can go see a specialist. So you can't just call up and book an appointment because you're not feeling well. You need to have another doctor tell you that you need to go see this one, and they'll actually write you out what we call a referral, which is a document stating all your personal details, all the doctor's professional details and their credentials and their provider number, and it should also include all of the patient's medical history and the circumstances as to why the patient has been referred to that specialist. So this referral to the specialist is going to be valid for 12 months if it's referred from a GP, or for 3 months if it's referred by another specialist. So patients, to be eligible for the Medicare rebate, they need to have a current referral to that specialist. So they can still sort of be seen by the specialist if the specialist is happy with that, but they just won't receive a Medicare rebate, which can be a bit of a clouding factor for a lot of patients, especially for those who aren't financially capable of just paying out of pocket for everything. So here's a bit of an example as to how one might sort of assign an item number to a thing. So if I were to go to my GP, because I'm not feeling well, and the doctor sat me down and asks what brought me in, and I just tell her that I have a headache and that I'm not feeling well and I'm feeling pretty nauseous. So the doctor might check my temperature and she'll find that I have a fever and tells me that I most likely have the flu. So she'll give me a request form to go have some nasal swabs taken. And she'll tell me to stay in bed for the next few days and just drink a lot of water. So she makes a note of everything that she said to me during that consultation and writes this all down in my medical file. So this whole consultation would take about roughly 15 minutes or so. So given this circumstance, assigning a Medicare item number to this consultation, I'd probably wind up assigning the item number 23. So here is a screenshot from the MBS of the item number 23, which you can see up there in the top left-hand corner. So the specifications for a consult to be billed as an item number 23 is that, so the doctor with whom I consulted was a general practitioner. So they were qualified through Medicare as a general practitioner. The consult took less than 20 minutes, which it did because I was only in there for 15. So another contributing factor to whether or not I can bill this as an item number 23 is what actually happened in that procedure. So we recall that the doctor sat me down and asked me what was wrong. She listened to my answers, so she took my patient history. She also, when she took my temperature, performed a clinical examination. And necessary investigations were actually arranged when she gave me the request to have some nasal swabs taken. So she also implemented a management plan when she told me to stay in bed and remain hydrated. So just sort of putting in a plan to take care of that illness. So the consultation was also documented when she wrote my notes into my clinical file. So we've got that appropriate documentation. Now, so because all of these requirements have been met, I can actually bill for that item number 23. So for the item number 23, the scheduled fee is $38.20. So for that one, I get the full benefit of 100%, which is the $38.20. So when taking payment for my consultation, the doctor's surgery can do one of two things. So we've got bulk billing, which is when the fee for that consultation, so the fee charged by the provider is equal to the fee that is specified by the MBS. So because it's equal to the MBS fee, Medicare can actually cover that entire fee without any contribution from myself. So because I don't actually have to pay for anything, this consultation can be billed directly to Medicare So directly against my Medicare account, and it will be paid using money collected from the nationwide Medicare levy. So that's that taxable income, the 1.5% taxable income. So as I said, I don't actually have to pay for anything. So it's bulk billed directly to Medicare, and it sort of like cuts out the middleman, so the patient doesn't actually have anything to do with it. So that's one way that the clinic could bill me. So the other way, which in private practice is a bit different. So in private practice, it's often times that the patient is actually charged a gap.